I would say that one of the biggest benefits we have in colorectal cancer screening is that we have multiple screening options. So, most people are familiar with colonoscopy as an option. This does require patients or individuals to come into a hospital or to a medical center or facility to get the screening test, which isn't always easy for everybody. So, it's wonderful that we have these other non invasive tests that don't require individuals necessarily to step into a health center. The first of these that we've seen is the FIT test, which is the fecal immunochemical test. There was an older generation of that, which was called the FOBT, but more commonly now it's the FIT test. That is looking for evidence of human blood in the stool, which can be a sign of cancer. The test that came after that is called the Cologuard test. It's a FIT DNA test made by a company called Exact Sciences. This test is looking for blood in the stool, but in addition, it has a DNA probe. So it's looking for DNA that's also consistent potentially with a colorectal cancer or a colorectal polyp. So those are the two that we see the most common when we talk about non invasive tests. We do have CT colonography, which is a CT scan that is done in a certain way to optimize the visualization of the colon. And, some patients will participate in that and as a non invasive option as well. Most recently, the biggest change that we've had in our field is the addition of blood based screening tests. This is the concept that you can go to a lab where you get your blood drawn for your annual physical, and they can also, at that same time, draw blood to screen you for colorectal cancer. There's only one of these that's currently FDA approved, but there's many of them that will be coming on the market soon. So a lot of patients come to us with questions about the pros and cons about these different non-invasive options. A lot of us continue to consider colonoscopy the gold standard, and a lot of people ask me why. There's a couple of things that happen with colonoscopy that we think are especially beneficial for the patient. Number one, in the colonoscopy, we actually get to look at the lining of the colon. So we are with our own eyes visually inspecting the colon walls as we use our tool to travel through the colon forward and backwards. That allows us to look for anything that looks like a polyp. That also allows us to look for anything that looks like a cancer. Second, because we're already in the colon with our special tools, we can actually address anything that we find. So if a patient does have a polyp in the colon, we can take it out. 95% of the time, we can actually just take it out then and there. Sometimes if they're too big or they look like they're too attached to the wall, we won't be able to take it out, but that's very rare. And upwards of 50% of people, we're going to be taking out a polyp during a colonoscopy. Now, if you have a non invasive test, the strategy is a little bit different. They're two-step test processes. So you're doing the first step, which might be your stool based test. And if that is negative, then you don't need to do the stool based test until you're due again. But if it's positive, then it's telling us the 7 to 12% of people who need to go on and have that colonoscopy to determine why the test was positive. So when I explain it that way to people, some people say, you know what, I like that colonoscopy option because I know you're going to visually examine. You can take out the polyps at the same time. But there are many people who say, I'm very busy. I'm nervous about a colonoscopy. I don't mind that two-step option as long as it's going to tell you whether I need a colonoscopy or not. The key, though, is that we need to guarantee that when people choose one of these non invasive options, they understand that they are signing up for a colonoscopy if that test is abnormal. I think that's an excellent question. And I think many of us are very curious to see where they fall. So, right now, I would say that the majority of physicians are still recommending that patients go ahead and pursue either a colonoscopy or one of these non invasive test options, like I mentioned, a FIT test, a FIT DNA test, CT colonography. There's another one called a flexible sigmoidoscopy, but that also requires a procedure. So most people are going to be suggesting that a patient picks one of those. And that's because those are recommended by the United States Preventive Service Task Force. It actually is in their guideline that these are the screening tests that they recommend. Um, so, what I'm starting to see, however, is that for individuals who are not able to tolerate a colonoscopy, or for whatever reason have hesitancy about a colonoscopy, or maybe have been refusing completing a stool-based test for years and years and years, that's the population that I'm starting to see physicians recommend the blood-based screening test. So we call that population of people who've been resistant to screening with the current technologies, meaning the colonoscopy and the stool-based test. And these individuals sometimes will agree to a blood test because they see that as something that's easier for them to complete. So that's the practice that I'm currently seeing. I think obviously that can change. Things that will make that change is that if there is a new guideline that recommends that physicians do prescribe the blood-based screening tests. In addition, I think as physicians become more comfortable with the blood-based technologies, they might be prescribing that more. But right now, I really think it's that very specific population that we're using these tests for.